bag. Where are you? Damn it! Damn it!
Damn it, Vince!
That blood look funny to you?
Still working on it. The code's a little janky. Hey, boss, you just like watching us get our asses shredded?
Yeah, not that you're not hilarious, but we hit the shelves in 3 months. Vince?
Vince, what's wrong?
My hands, they're on fire. This guy came in with burning pain caused by erythromelalgia caused by mercury poisoning.
Who needs actual doctors when you got the internet?
Well, no offense, but doctors make mistakes. Medical errors are up 30% this year.
You should check the rate of patient error.
There's a ton of information out there. Why wouldn't I educate myself, be my own advocate? CRPS came up in my search too, but I've never had any skin discoloration and my pain is sporadic and not constant. It's gotta be worth one lousy blood test.
Your blood test ruled out mercury poisoning.
What was my mercury level?
2.8. That means for every deciliter of blood.
I know what it means. I also know it's above normal. I want mercury chelation.
Your level isn't elevated enough to produce your symptoms.
So you can't know that until we de-elevate it and see if my pain improves. It's a judgment call.
Based on 10 years of medical training? I think you have CRPS. I want to try spinal stimulation.
So basically you want to shove a needle in my spine based on a glorified hunch. I'll stick with the chelation.
If you don't want to get better, I think we're done.
What do you mean, done?
You're not interested in my medical opinion. I'll move on to my next patient. You'll move on to a doctor willing to run all the unnecessary tests and procedures you want. Or you can stick around and be cured. Makes no difference to me.
Is this supposed to hurt?
Not if we're in correctly. Is it your hands, your back?
No, my chest. Can't breathe.
Heart rate's 140, climbing.
You need to hold still.
What did you do?
Deep breath.
His lungs are filling with fluid.
Analysis of the fluid from Vince's lungs shows the lung problem is really a heart problem. He's got a thickened left ventricle.
When his heart sped up during the procedure, it jacked up the pressure in his lungs, causing pulmonary edema.
Good thing I talked the patient into spinal stimulation.
It did lead us to discovering a new symptom and proved he was wrong about mercury poisoning.
We lucked into that discovery, and we were wrong about CRPS. Ventricular thickening plus neuropathy could equal Lyme disease.
Not without joint pain.
When's his new game coming out?
Couple months.
He's probably working nonstop. Might be using more than coffee to power through.
Cocaine use explains his symptoms.
So we search his office for drugs.
That's one big-ass bird.
Kind of amazing the way the wings move. It's so real.
Get them off me!
I know what's wrong with the patient. I'm going to call Foreman.
Little help. Your partner said you studied birds to improve the game animation. Did you touch them?
Can't dissect without touching. It's the best way to understand the anatomy.
It's also a good way to contract an infection called psittacosis. We spoke to Dr. Foreman. He wants to start you on antibiotics.
Does that infection cause problems in the joystick area? Kind of stuck in play mode.
Yes, we get it. She's very, very pretty.
It's not her. I mean, it was. When she was here with her boyfriend 3 hours ago.
You've had an erection for 3 hours?
At first it was just embarrassing, but now it's really starting to hurt. Will the antibiotics help?
I'm afraid not. This isn't psittacosis.
His lymph nodes blew up. He's been treated for thrombocytosis, but there's been no change.
I was wrong.
God, you are a genius. I'm adding this to my list of symptoms.
That didn't work last time.
Because I didn't think big enough. Now I'm offering a $25,000 reward.
Your stunt generated quite a few responses. Let's take a look.
I'm way ahead of you.
Paraneoplastic syndrome secondary to spinal tumor.
No hypercalcemia, no muscle spasms or incontinence.
You are possessed by the biblical demon legion.
No jumping off a cliff in a herd of pigs.
Otherwise, it did fit. Graves' disease.
Nope, thyroid levels are normal.
You want us to spend the next few days shooting down every theory in the world? Or can we do our jobs and come up with one that works?
I want you to test me for amyloidosis.
That's your professional opinion?
It's the wisdom of crowds. Studies show the collective decision of a group can be more accurate than any individual's decision. Went through my emails, amyloidosis got the most votes.
If you had amyloidosis, there'd be speckling on your cardiac ultrasound.
In 100% of cases.
Fine. I'll make you a deal. We'll do a kidney biopsy to test for amyloidosis. When it comes back negative, you pull your case off of the internet and retract the reward. It's either that or I don't test you at all.
Deal.
Vince, relax. It's Dr. Foreman. Because he's burning up. Amyloidosis wouldn't do this.
We think you have a disease called LCDD. It causes proteins to build up in your organs.
You think?
We can't definitely confirm the diagnosis.
And the only chance of beating this would be to start you on high-dose chemotherapy. But I do have to warn you that in your condition, it might kill you. Do you want me to get you some more information?
You're my doctor. I trust you.
No, you don't. You're scared, and you don't want to make this decision. My career is riding on this case. Nowhere near as important as your life. But I think the best shot for both of us is to treat for LCDD.
Okay.
Stop the chemo. He's got Fabry's disease. He was in the tub for an hour. His fingers should have pruned, but they didn't.
Already stopped chemo and confirmed Fabry's.
I'm glad you both agree, but could somebody loop me in here?
We assumed the deposits in your kidneys were proteins, but they were fats. Fabry's makes them build up in your organs, choke your nerves, keep your fingers from pruning in water. It's chronic, but manageable.
How'd you figure it out?
Iodine mumps. His lymph nodes swelled up after the head CT. We thought it was a new symptom, but it wasn't. It was a reaction to the contrast. Iodine mumps takes lymph nodes off the table. Remove that symptom.
And that just came to you?
I looked through the online responses again. Someone posted it this morning.